And I think that's what you were saying is part of the training that needs to be in the biopsychosocial. So as far as the opiate abuse, I'm seeing it from older people to people as young in their teens. So it's
that's terrifying. Those teenagers, are they starting with this stuff because it's so available and on the street?
Generally, no. They progress to that. I find that most of the people, when they do abuse it, they're crushing it. So that the timer is, and they get quicker action. But also what happens a lot of times with people with pain, because we deal a lot of chronic pain, because you have to really make sure that there's a difference. You have to make sure, sometimes people become physiologically addicted to the opiate, but then it keeps on increasing because the tolerance increases. So when we put someone in detox who actually utilizes it because of chronic pain, we now call it a transition. Because they will be going back on that medication again. But then you have the person that is actually abusing it and using it to get high. So you really have to be able to know the difference between the two.
And that's not necessarily an easy thing to determine, is it?
No, it takes a long history, good clinical interview skills, and knowledge, and working with the physician.
Mr. Giordano, I know you do the holistic treatment approach. What do you find to be most effective?
Well, it's a number of approaches. You don't just use one approach because everybody has what is called a different footprint. We're finding out, we have a, matter of fact, you've seen on football players and a lot of different people, this thing called life wave. These are these patches, nothing goes in the body. It works on the infrared system of the body. It sounds a little wild, but when the scientist spoke to me about it, I thought it was one of those guys. So we've been using it for the last 2 years. He wasn't one of those guys. We've been putting them on clients, and it's been incredible. It works within 3 seconds. And usually when I lecture up at FSAM, which is the Florida Society of Addiction Medicine, last year when I lectured up there, the docs were like going, rolling their eyes, and I said, okay, I need somebody to come up. And I put the patch on him, and he's going like this, and he goes, what is this? And it was about 5 minutes before I ended my lecture, and I had a bunch of other docs come up, about 8 of them. If you were to walk into the room and watch everybody who had a meniscus problem, shaking his knee, who was doing this, you thought they were doing some kind of advance. They all could not believe how well this works. You have acupuncture, you have cold lasers, you have hyperbaric medicine that also works and helps. You have massage therapy, you have yoga, chiropractic. It's a tremendous amount of varied technologies that you can use. They have H-Wave, which is FDA approved. They have a thing called the scanner, which is from Russia, that also brings frequencies.
So in other words, different strokes for different folks.
Different strokes for different folks, and maybe all of them. I'm a perfect person, I just had a hip. They just operated on my hip. They had to grind down my hip. It's only 3.5 weeks. And I'm walking pretty good for 3.5 weeks. And I have one of the patches on me right now that I put on my hip. And I do the H-Wave, and I do the chamber. And the doctor can't believe that I'm so far ahead of my schedule.
That's great. Congratulations to you. Dr. Hall, how's about the genetic component to addiction?
It's one of the historic questions. And basically where we are today, but yet it has a great promise, really for the future of the field. Today we realize probably epidemiologically that about half of the key risk factors for an addiction disorder have a genetic component to it. It's not a simple genetic component, so it's not an issue of a single gene. And genetics can be related to different genes for different substances of abuse. And as well, it's more that combination pattern that is really giving us some of the really key insights. The genetic makeup is also really at the forefront of pharmacokinetic treatments, pharmacotherapy treatments for addiction disorders. We now realize that some patients respond better to certain medications in the recovery process. and that very much is a genetic component. So we're approaching the point where we can actually do genetic testing and determine what will be the most appropriate medication for that client.
Sounds promising.
It is, so that we're on the breakthrough of that. We also are aware that there are genetic relationships, for instance, some of the nicotine receptor sites related to nicotine addiction. Some of the genetic predisposition for that would also be related to lung cancer. So not only to the addiction, but also to the adverse consequences of that addiction might be cofactors. The real promise, though, is how we may have now a clearer kind of pathway to some of the key determinants of addiction and